about the development of adjacent segment degeneration of multi-level fusion in anterior cervical arthrodesis with Casian plate augmentation. Anterior cervical decompression and fusion has shown great success in both clinical and radiological point of view. In recent years, we could observe increased initial stability, improved bone fusion, and early mobilization with the use of anterior plate fixation. These days, adjacent segment disease is one of the most controversial issues in cervical spinal surgery. It is believed that arthrodesis of spinal segments leads to excessive stress at unfused adjacent levels. There are several studies that have reported the affecting factors such as fusion number, location, age, and cervical alignment in the adjacent degenerative changing. The purpose of this study is to analyze the effect of multilevel fusion to the development of adjacent level degeneration in anterior cervical arthrodesis for degenerative cervical disorder. 127 patients were included and were followed up for more than 3 years. Here's a retrospective study. Anterior cervical decompression and fusion using Casian plate were performed in all cases. We divided them into two groups. Group A composed of 55 patients who underwent one-level fusion, and Group B composed of 72 patients who underwent 2 or 3-level fusion. We observed all patients regularly after the surgery. During the observation, we took lateral radiographs and flexion, extension, and dynamic view. Also, neurological examination was carried out. We graded Bonis formation. Grade 1 was defined as no Bonis formation, grade 2 as Bonis for extending across less than 50% of the adjacent disc space. Grade 3 as extending more than 50% of the adjacent disc space, and grade 4, complete bridging. Also, we divided degeneration into 4 stages radiologically by narrowing of adjacent disc space and scored it according to the points given. The symptomatic adjacent disease was defined as the development of symptom at the adjacent spinal level and confirmed by MRI. Result. There was no significant difference in sex, age, and follow-up period between two groups. Grade 3 and 4 Bonis formation were more in Group B. In score conversion, Group B showed 2.43 points and it was higher than Group A. For disc space narrowing, grade 3 and 4 were more in Group B compared to Group A. And in Group B, score was 2.38 and it was higher than Group A. However, adjacent symptomatic disease in Group A was 7.3% and 8.3% in Group B. No significant correlation was found. Let me show the cases. A 61-year-old female had ACDF with a Casian plate for C5 and 6. After follow-up of 57 months, it showed grade 1 Bonis formation and grade 2 disc space narrowing in the adjacent segment. A 62-year-old female had ACDF with a Casian plate for C5, 6, and 6, 7. After follow-up of 63 months, it showed grade 3 Bonis formation and grade 2 disc space narrowing in adjacent segment. A 62-year-old male had a 3-level fusion and after 58 months, grade 4 adjacent segmental Bonis formation and grade 4 disc space narrowing was showed, but patient was asymptomatic. A 58-year-old female had a 3-level fusion from C4 to 7. Grade 4 Bonis formation and grade 4 disc space narrowing showed after 76 months. Several biomechanical studies with cadaver specimens have supported that cervical fusion increases load and motion at adjacent levels, but some clinical studies have demonstrated that there was no significant relationship of affecting factors such as numbers of fusion level. However, in our study, multilevel fusion have accelerated degenerative changes at the adjacent level of patients who underwent ACDF with Casian plate. These findings suggest that multilevel fusion with Casian plate accelerated degenerative changes influenced by stress concentration of adjacent segment. In general, there is no relationship between symptomatic adjacent segmental disease and radiological degenerative change. In this study, we found that multi-level fusion has not increased the adjacent segmental disease, and adjacent degenerative changes was not related to the incidence of adjacent disease as reported. We consider that a combination of factors probably contribute to adjacent disease development, including the natural history of cervical spondylosis. Multi-level fusion with cage and plate augmentation can accelerate the adjacent level degeneration as compared with one-level fusion, but there was no correlation in the incidence of symptomatic adjacent level disease with the numbers of fusion level. Multi-level fusion with cage and plate augmentation could be considered as one of the recommendable surgical options for multi-level degenerative cervical disease. Thank you for your attention.
Thank you.